Good afternoon, ladies and gentlemen. The Vice President, Comrade Chiwenga, the Honorable Minister of Local Government, the Deputy Minister, the Deputy Minister, Karatatos, Deputy Minister Matuke, Deputy Minister Manchingura, Permanent Secretary of Health, the Director of Creative Services, Minister of Health, and all distinguished dignitaries. I would like to welcome you, sir, to our esteemed institution, the only central hospital attending to mentally ill patients in Zimbabwe, where a 708-bedded hospital currently accommodating about 600 patients in 15 wards dotted around the stages. So we are attending to 2,500, 3,000 patients in our patients department. Even during the strike with all the COVID, we have never closed. Our figures have always remained at 600. This hospital was opened in 1908. And up to 1958, and 1950s, when effective medication was developed, it ran as an asylum. So people would just be either locked up or made to work on the farm as part of occupational therapy. So this legacy of agricultural activities has continued. As you saw today, we've actually used farming to sustain our operations, since funding from central government is minimal. So to look after all these 600 patients, we've had to think outside the box and look after our patients. As you notice, most of our patients, they consider Ingutsheni their home. Actually, more than 50% of the patients here, they've been admitted for over 5 years. The oldest has been here since 1952. Our society stigmatizes mental illness, so it's difficult to discharge patients home. Some of them have committed serious crimes, as you saw in that ward, that Mambo ward, against their families or the communities, like murder and rape, so they cannot return to their homes. Others have severe mental retardation and physical disabilities. Their families cannot look after them, but to keep them here until the old age and death. Our staff is highly dedicated and passionate about their work. As I mentioned, during the industrial action, none of our staff participated. And God has been very kind to us. He protected us against the effects of COVID-19. We've remained COVID-19 free in this hospital. We continue to remain vigilant. As you saw sanitization from the gate. In other institutions, in other places, you find people mislabeling, but here we've always been sanitizing from the gate. It's become part of our culture. And we don't want to spread COVID-19 to our patients who are here permanently, we are chronic patients. In terms of our achievements, we have these projects which you saw. We have the horticulture project which you saw that side, which has got a lot of issues which also need to be improved on. We have the chicken project which we hope is going to keep on rolling over until we are producing at least 5,000 chickens a month. The Zimbabwe Peace and Operation Services actually have been assisting us with some vegetables. They also promised us to grow food for us as long as we have your inputs to them. Then the cattle fetching and the goat project, we were trying to push that into 2021. So as you notice in the report which we're going to give you, the farming requirements, we've put them in an appendix, which we call Appendix 1. So you actually look at that and you'll see the farming projects. We also offer specialist services for our patients. Unfortunately, because of difficulties with the referral chain, sometimes people are actually jumping from the primary care level straight to the specialist level, so increasing our problem here. So obviously, that goes back to my friend Dr. Mulilo to the City Council to capacitate the clinic so that people are actually looked after in their environments, not all coming here to the specialist unit. We've got psychologists, we've got occupational therapists, we also have social workers. We're hoping they are teaching our patients. We also have a big school of nursing which has been churning out thousands and thousands of graduates who have been going to the UK over the years. That's why we don't have a lot of psychiatric nurses. Our nurses are highly sought out outside there, so they tend to keep on going and going, but to keep on training. We also now developed a 3-year program for registered mental health nurses as well, which is also going to fit into the districts and also the rural health centers. So that we have mental health practitioners outside. In terms of our challenges, there are lots of challenges. The challenges with our infrastructure, as we saw in the buildings, and also we made a list of that, which you actually have to look at later. We also have challenges with the medicines. The medicine supply is also very difficult. We end up using the basic drugs we developed in the 1950s. rather than using the more expensive drugs. But obviously, for us to be using the more expensive drugs, we must be capacitated. That's why we are thinking of doing this project, so that we're able to produce, if more money, we're not able to buy these more expensive drugs. We are going to have better outcomes for our patients. In terms of human resources, we don't have the only psychiatrist, the local one, and 3 people, psychiatrists. Our local consultants are not willing to come here. It's something which my friend Ingutsheni has to look into and see how he can bring them. Because since 1940, we've always had expatriates in this hospital. As a central hospital, we also offer training to medical students at NAST. So we need more specialists to also facilitate that. And then our nurse patient ratio is very big. We need more nurses to be employed. Unfortunately, the establishments, I think we understand they've always been old and they need to be updated so that we can have more nurses attending to our patients, because some of them require one-on-one care. We also need support staff to assist us. We already mentioned the issue of the general hands and the family. So I hope we'll be able to get those. And then we'll be able to improve on our work. We will also actually outline our staff requirements in an appendix. In terms of finances, we'll be doing very well because of what we've been doing. Our projects have been helping us to assist, to look after these patients. Of course, we still need more money as the year is coming to the end. The good thing is the economy is stabilized, so we are no longer having this price fluctuation, so we're able to actually plan a budget. The water supply, I think you also saw, remains a perennial challenge. So for all these boreholes, but we need to find someone who can actually put these boreholes together and make them work. Hopefully, in future, we'll consolidate our work using the agricultural potential which we have just seen. And we also want to use our colleagues in the army, the police, and the prison services, and also at NAST. We want to lean on them so that they can come and assist us to improve our work here. And also look at rehabilitating our infrastructure. Obviously, we need more vehicles for our nurses. Our nurses sometimes when they finish work, it's always difficult for them to go home. But they still have been coming to work, even despite the fact that they have to walk from town to here. They still have to be coming religiously to work. So we do with a bus. We get a bus actually to ferry our staff. A big bus and a small bus when there are less people there. Then we can actually be ferrying our staff up and down. Then actually it can improve the morale of the patients. You saw the road when you're coming in. The road network here. I don't think it's going to be attended to. So it's something which we also need to look into. The other issues are the outlook of the hospital, talking to the private sector to try to help us put signs around the hospital. So at least people know where they're going. And also we need to improve our IT, particularly in information technology, particularly with the School of Nursing, which needs to really become more computerized so that they can move with everybody else. In conclusion, I would like to thank you for the honor you have accorded us. You are the first hiring official, government official to visit our institution in over 100 years of its existence and told. No ever high-ranking government official has ever come here. If you have come for graduation ceremonies and things like that, but you are the first one really to put us in the limelight. So mental health to us, I'm so happy, I'm so proud today that mental health has actually come to the forefront. We put in the limelight, and also excited with the prospects for our hospital and patient care, which will be enhanced as we are not left behind in the drive for the whole country to achieve upper middle class economy by 2030. I thank you.
I'm going to ask the Vice President to respond. Honorable Ministers, peers, all senior officials. I was whispering before you came in here, Honorable Vice President, and as if we knew, we just said, you must imagine that this is the first Minister of Health who has come to do this tour. Now you are confirmed. We were checking, but now we can confirm. Honorable Vice President, I want to say this institution is very fortunate that at the beginning of your work he have come to visit. But I also want to tell the people here in Mlawan, Minister included, as well as PMG and the administrators of this hospital. The Vice President does not visit. He revisits and revisits. So when you see he has come, he will come back. Those in the agriculture sector know it. He checks, he sees like he has seen, and he comes back. So this is a visiting Vice President. And there is no other way we can supervise and reorient these institutions except through coming to visit the way the Vice President is doing. And all of us are learning from it. We learn new things. I also wanted to say this Vice President, having visited and noted what he has to be done, he will supervise not just you, he will supervise us. So you can also be rest assured what you are telling him, and when he replies and says, this will do, he will not just do with you, he will do with us. And I want to promise before I sit down, Honorable Vice President, that I'll talk to Zuko so that we can put a bus to this place so that your nurses, your staff can be looked after, since it is a little bit outside town. And the road, I will be discussing with the City Council so that they can do something about it. And I'm sure that my sister, the Minister of State, will also do the same. So I cannot continue to introduce to you somebody you will be seeing all the time. I can only invite him on your behalf so that he can speak to us. Honorable Vice President.
Well, be seated. The Minister for Provincial Affairs and Devolution, Mlawan Metropolitan Province, Honorable Judith Nwe, Minister of Local Government, Public Works, Honorable July Moyo, Deputy Ministers for Higher and Tertiary Education, Innovation and Science and Technology, Dr. Machingura, Deputy Minister of Lands, Agriculture, Water and Rural Resettlement, Honorable Archetas, Deputy Minister of Public Service, Labor and Social Welfare, Honorable Lavmo Matuke, the Permanent Secretary for Health and Child Care, Dr. Jasper Chiwenga. Our hosts, maybe before that, let me recognize the Provincial Medical Officer, PMG, Dr. Murilo. Our hosts, the Acting Chief Executive Officer, Ingutsheni Central Hospital, Dr. Mawere, and your staff. Invited guests, members of the press, ladies and gentlemen, comrades and friends. Oh, I always forget my colleagues in uniform. Members of the provincial job, sorry, because sometimes I forget that but we are still together even if we are retired. Let me start, before I go into my speech, to say thank you very much for your welcome. Last night, we had a very fruitful discussion with Dr. Mawere and his colleagues, where we just come from, Dr. Dube. I only realized that it was 12 midnight. And we were discussing most of and they were briefing me on what challenges they were facing, what they would want to see. And I was trying to visualize what needed to be done. But I said, to Dr. Mawere, I have brought in an able team. Tomorrow, the Minister of Local Government will be joining me. And I've got Minister of Lands, Agriculture, Water and Rural Resettlement, who are going to be playing a major role. And of course, we've got our Minister for Higher and Tertiary Education, where we would want to develop staff at NAST University for this institution. Not worry about people who, when you train, they get poached. They will be poached, but they will come back. And let's continue to train PMD. Dr. Murero, we agree on that. Let's continue to train. Our people are precious to us. And we need to look after them. Some of them will recover. Some might not. It will be the will of God. But let's look after them. In whatever state they will be. And this place, I can tell you, Dr. Mawere, it will never be the same again. That we can assure. And we will try and we will do our best together with my colleagues here. And as Minister of Health, yes, and child care, we cannot provide everything. But with the colleagues here from the various ministries and those who are not here, we will try to make sure that that is done. As you will be dealing with the issue of excellent Minister Moyo, let's just, when we go back to Harare, the Minister of Transport, not to wait for the seat of Bulawayo, you should just make that road motorable, get it tarred. We have got other agencies like Zinara, they can come and do that piece of road to here. Let's make it a better place to live. I'm happy that the transport temporary will be done, but as we go back to Harare, I think in our kit we have got some money. We shall provide you with buses for Ingutsheni, and that we have started to be to come to be here. Let's provide those buses for both. But the first priority will come here at Ingutsheni, and then for Impiro and UBH. Those buses will have to be bought, and we want those buses, God forbid, before the end of this year, they should be here. Ingutsheni Central Hospital is a key health institution whose preoccupation is the treatment of mentally challenged patients. I am informed that at least 600 patients, which the acting chief executive officer has just confirmed now, are sectioned at this institution, where I've also taken time to tour the Western Farm and the Eastern Farm, another section of the Central Hospital. In the briefs that I have been favored with by the Acting Chief Executive Officer, Dr. Mawere, it emerged that Ingutsheni Central Hospital is facing some logistical challenges that can be overcome. Chief among the highlighted constraints is the issue of shortages of medicines and drugs that are desperately needed by our patients. I have, however, noticed that some of the medical stocks in short supply at Ingutsheni Central Hospital are in stock at similar institutions elsewhere in the country. This problem can be resolved by streamlining our supply system to ensure that quantities of medicine in surplus stock at other institutions are rationalized, with a view to replenish Ingutsheni Central Hospital. And the Secretary for Health and Child Care is going to be seized with the matter of making sure that the required medicines and drugs are here. You might also want to know, Dr. Mawere, that in our vision, we have planned to reopen all pharmaceutical companies, and there are 13 of them. And all the drugs we can make here and medicines we can make here in Zimbabwe will be made here and we will not import. Gone are the days where we could export our labor and take the little foreign currency we have and give to other nations to develop, yet we can't develop. What we are simply saying is, even if our drugs, let's say our tablet is $10 and that one we are going to get outside is going to cost $5, we will buy Zimbabwe. We will not buy outside. We want, one, to make sure that there is employment for our people. That's number one. Two, that we develop for ourselves and not depend on other people. We must be self-sufficient. Similarly, the Ministry of Health and Child Care will leave no stone unturned in robust endeavors to secure specialized medicines to allow our sectioned patients to be discharged from hospital and go home. Those that can be treated and be able to go home, we should be able to do that. I want to also take this opportunity to urge families back home to take good care of mentally challenged members. They depend on our collective responsibility to attend to their welfare needs. In this vein, Ingutsheni Central Hospital must impart vocational training to patients who, when discharged, can play a pivotal role in the socio-economic development of our country. We should not forget them and say they are a foregone case. Those that can be trained, those that can be rehabilitated, let's rehabilitate them and they become useful citizens again in our society. Vocational training will empower citizens with requisite skills for them to survive outside the institution. I am also aware of the project of nutritional gardens currently running at this institution. Ingutsheni Central Hospital is endowed with a sizable farm, an inventory of farm implements and irrigation systems. Among the farming activities being undertaken include horticulture, poultry, and animal husbandry, but at a very low scale. Now, what we are going now to do is to send a team from the Ministry of Lands, Agriculture, Water and Rural Resettlement to come here in two parts. One from the Irrigation Department and the other from the Agriculture Extension Services, to come and plan, to replant the 90 hectares which you've told us, so we can now have livestock from cattle fattening project into small, animal rearing like goats, sheep. We need also to do piggery, so that all the protein requirements are met, the meat requirements are met. We need to also do poultry at a large scale. And because there are so many bowls in here, which some of them which are unserviceable, they have to be repaired, so that we can irrigate this area. We need to put greenhouses. That money will have to be found, so we can now supply Mpiro General Hospital with all their vegetable requirements from this farm. Supply them with their meat requirements, and we cut the costs for the procurement of food. The food produced here will be for both the patients and for our health staff, our clinicians. We also need to, Minister of Agriculture, to develop the fishery projects, as we have discussed, as we are going down. So we now have on the vitamin side, with the vegetables, and the protein side with everything from beef right up to fish and poultry. We need to develop that, and that must be done as a matter of urgency. Before we came here, we discussed the issue with His Excellency the President, and we will be bringing you equipment, tractors and their implements, so that you are able to utilize and then provide. In terms of that establishment which we are talking about, that is going to be reviewed by the staff at the Ministry of Health, and will give you the grounds. What is it? The what?
Justification.
Sorry?
Justification.
Yes, I know, but we'll give you that personnel to work on the farm. Farm yes. Yeah, so that those the ones who are doing the cleaning will continue to do what they are supposed to be doing for the patients. And then we give you the farm hands, so they can be able to work, and that those can be recruited locally here. So I also expect them to widen the scope of their activities, all these projects, by increasing their acreage to embrace the citrus project. We've got the citrus which we have seen there, but we also need now to expand that citrus, and grow all types of fruit. So we are able to give to our patients, they be in the UBH, they be in the Mpiro, and here at Ingutsheni, that they have their own fruits throughout the year. in my capacity as the Minister of Health and Child Care and also as Vice President, I want to implore upon all provincial districts and clinics to emulate and replicate the self-sufficient model showcased by Ingutsheni Central Hospital. That, Dr. Muriro, you have to start. At least at the clinic, people can plant 10 different types of fruit trees. Have a garden of vegetables. Rather than saying we need a tender to go and buy vegetables, why can't we do it ourselves? We should be able. We can give 2 general hands, 3 general hands to do that. And that you will find it will be more profitable than going around trying to buy cabbages which might have been in the sun for the past 3 days, rather than buying, getting the fresh vegetables from your own garden. So let's do that. Such quick impact projects remain key in the enrichment of nutrition for patients and our hospital staff. The initiative will go a long way in reducing the budgetary allocation set aside for the procurement of food and related items. Implementation of this self-sustenance policy by all our hospitals will certainly curtail the food deficit situation in some of our institutions. My ministry will also ensure that farm mechanization implements to resource the nutritional gardens projects are sourced from relevant ministries and other stakeholders. Meanwhile, my ministry is seized with the problem of reticulation of piped water at Ingutsheni Hospital, Central Hospital. Efforts are underway to improve the situation. Running water is vital for the upkeep of hygiene at our institutions. To this end, my ministry is going to engage relevant ministries and other stakeholders to expand the water reticulation capacity at this central hospital. That will be done as soon as the people from the irrigation and Zinwa, they will all come from the Ministry of Agriculture and will help you to deal with the problem so we can resolve it once and for all. I'm also aware that Ingutsheni Central Hospital has got a huge garage that has not been comprehensively exploited for the benefit of the hospital and others in the region. The aforesaid garage must be reconfigured to enhance its capacity to attend to all vehicles in the region. In other words, the region we are talking about is the Matabeleland region, and even going as far as others in the, into the Midland. This is a huge complex which must now be developed so we don't send vehicles in the local garages. We must be able to repair our own vehicles. Due diligence must be accorded to the repair and maintenance of our hospital fleet, a stride which will improve health service delivery. In conclusion, I want to express my utmost gratitude to the Ingutsheni Central Hospital management and staff for engaging in the training of nurses at this institution. This is indeed a noble endeavor which other medical institutions should emulate. Training is key in the development of our human resources. And I also want to salute the staff, your staff, Dr. Mawere, that whilst they operated under very difficult conditions, they never took to industrial action or withdraw their labor. More importantly, that they are looking after mentally challenged patients. If that would have happened, it could have spelled a disaster. Say to them, well done, and thank you, and thank you, and thank you. We never leave our patients. Never. No matter what difficulty we go through, and play around with our patients so we can achieve our desired goals. No. They can never be used as though one is using police in the game of chasing. Atidaro, ukarasika, autuke, munaisimbewe utinodyarwa ichizumera futi. So I want to salute you and your staff for having remained resolved and never took industrial action, and for that they will be rewarded accordingly. Siyabonga, Tateno.